Hello, I'm Dr. Brandon Blue, an assistant member of the Malignant Hematology Department at Moffitt Cancer Center. Multiple myeloma unfortunately disproportionately affects African American and Hispanic patients. That's my community, and that's why I'm personally really interested in trying to make sure that we improve the disparities for all patients with multiple myeloma. We're here to discuss disparities across multiple myeloma patient journey with Gary, a multiple myeloma patient and survivor.
Hi, I'm Gary Lambert. I was diagnosed with stage 3 multiple myeloma in 2014, and I've been living with myeloma for 10 years.
Now, before we get into it, I want to say that I look forward to answering your questions on disparities in caring for multiple myeloma and hearing your perspective as a multiple myeloma patient and survivor.
Dr. Blue, you and I have already discussed diagnosis and treatment. Now let's focus in on what it's like to live with myeloma as a chronic disease. For me, there have been big differences between year 1, when I solely focused on staying alive and going through the rigors of weekly infusion, to now, year 10, post-CAR T and in remission, where I only have to check in every 3 months or so. How does follow-up care vary across race and ethnicity?
Follow-up care for myeloma typically includes periodic testing to monitor for relapse and long-term side effects. Unfortunately, studies have shown fewer Black patients make it to their follow-up appointments than white patients do. One way to deal with this is to increase access to telemedicine visits, which can shorten the time between follow-up visits and increase visit completion rates. Follow-up care may also involve coordination between multiple clinicians, including primary care, oncologists, pharmacists, and nurses. In one study, patients of color were more likely than white patients to report that their personal doctor did not have up-to-date information on their medical records and specialist care. They were less likely to receive help managing their care. Nurse coordinators and electronic health record-based tools that transfer information across the healthcare team may help to address these gaps in care coordination.
When I was first diagnosed, there were the standard triplet regimen: a proteasome inhibitor, immunomodulators, and a steroid, and a few variations here and there, and then, if you could withstand it, auto or allo stem cell transplant. Now there are immune therapies, CAR T, and other emerging targeted therapies. Do you think myeloma patients are living longer with all of these new options?
Great question. Over the last decade, the length of time that patients with multiple myeloma survive after diagnosis, also known as overall survival, has nearly doubled due to the advances in multiple myeloma therapy. However, Black patients in general have lower overall survival and have experienced slower improvements in survival rates compared with white patients, despite the fact that Black patients are less likely to have high-risk disease features. This is partly because Black patients are more likely to have lower socioeconomic status, limiting their access to standard of care treatments.
Can addressing the differences in access to treatment decrease the differences in survival rates between Black and white patients?
Yes, studies have shown that survival rates may be worse for Black patients overall, but similar between Black and white patients who receive standard of care treatment such as triplet therapies and stem cell transplant. Altogether, this means that ensuring equal access to therapy for all patients with myeloma can help address racial disparities in survival outcomes. Also, patient assistance programs and compassionate use protocols may help to improve access to treatment for patients of a lower socioeconomic status.
Dr. Blue, thank you for sharing your thoughts, and I hope that clinicians will keep these considerations in mind as they interact with patients like me.
This was a great discussion. Thank you.